Hi, good morning, Anthony. My name is Mia Campbell. I'm your invigilator for the OET speaking session on the 8th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Anthony Thompson.
And what is your candidate number, please?
My candidate number is 211302431.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What methods would you use to train new nurses in a facility?
As a nurse manager, I will be charged with the task of training new nurses and familiarizing them with the facility in which they are about to work. I would first provide an explanation of what is expected of the new nurses, as far as patient care, documentation, and more. Next, I would provide a physical tour of the facility and explain daily operations. Finally, I would assess the nurse's abilities during the first few days and provide insight and advice if anyone seems to be struggling in a particular area.
Are you proficient with working in a team setting?
Providing quality health care to any patient is impossible without a team of professionals working together. All of the nurses responsible for providing care to any patient should maintain close communication with each other and with the physician responsible for the patient's care.
What do you think your coworkers would say about you?
I am a very stringent manager, and I am very matter-of-fact when providing assignments or when scheduling. My coworkers would say that they enjoy working with me because I am very thorough in everything I do. Finally, they would say that I am 100% dedicated to the well-being of my patients, and they put their care above everything else.
How would you handle a short-staffed shift?
I ask the nurses to tell me if they are interested in taking on extra hours, and I keep a list of their names. If a shift is short-staffed, my first order of business is to contact those nurses to cover the schedule. If for any reason I am unable to find a nurse who can take on the hours, I would report for duty myself.
As a clinical nurse manager, what is your management style?
In my experience, delegating responsibility and authority is crucial. A team needs to be able to develop and grow as individuals in a whole, not be held back by low expectations or ego. I believe in building a team. Each member of the team should be clear on their role, know where they fit in, and feel as though they can depend on one another. I also believe in real-time feedback. If you do something wrong, you should know it immediately. Regardless of right or wrong, the further removed feedback is in time, the less effective it is.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Excuse me, please.
Yes, how may I help you?
Can I have a name for the patient, please?
You can call the patient Mia Campbell.
Thank you.
No mention, please. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good morning, Mia. I'm your nurse Anthony Thompson here. Is this the right time to talk to you?
Hello, nurse. Good morning. Yes, it's okay to talk right now.
Thank you, Mia. Let me confirm your record first. You are Mia Campbell, 32-year-old, who had a hemorrhoidectomy 2 days ago. Am I right?
Yes, nurse.
Thank you for your confirmation. So, Mia, how are you feeling today?
I am okay, nurse. Thank you for asking. Well, I have got constipation after the surgery. And I am worried about it.
All right. Nothing to worry, Mia. Constipation is very common following surgery under general anesthesia, because the anesthetic effect paralyzes the bowel. Furthermore, some pain medications can also cause the bowel to move more slowly.
Is it?
Yes, it is. In addition, a fear of bowel movements and the associated pain can lead to functional constipation. You are also experiencing the same, isn't it, Mia?
Yes, I am.
Though the first few bowel movements can be difficult, it is better to move your bowels regularly than to become constipated. Since after 2 days, if you haven't had a good, relieving bowel movement, you can take 1 to 2 ounces of milk of magnesia, or another mild laxative you know will work for you.
Sure, nurse. I will consider that.
It is very important that, to have a regular bowel function, you must eat regularly. To help prevent constipation, you must consume an adequate amount of food. This is best accomplished with a fiber-rich diet. So, may I know your diet after surgery, please?
Nurse, in fear of pain, I restrict my diet myself on the first day. Now, as it becomes constipation, I am not feeling good about taking food.
I truly understand your situation, Mia. What you have done is quite natural. Now, don't worry about the pain while having a bowel movement. Stool softeners will keep stool softer, so that no or less pain will be felt. Hence, you should make sure you eat well.
All right, nurse. I will consume food as usual.
In addition to all of these, sitz baths twice a day. Along with stool softeners, sitz bath can relieve the pain associated with bowel movements. When you take a sitz bath, you sit in warm water, and it helps relieve pain. Sitz bath can help speed up the healing process by boosting blood flow.
Okay.
You can also include a more fiber-rich diet for better bowel movements.
Can you please explain to me?
Sure, it's my pleasure. The best way to actually consume sufficient fiber is with the high-fiber cereal. Consume 12 to 14 grams of fiber per half cup of cereal. Fiber in all bran 100% brand bullets are examples. Half to 1 cup per day is sufficient. Also, I will provide a leaflet for you. That will help you to choose a fiber-rich diet as per your preference.
That will be very helpful, nurse.
Great. Along with a healthy diet, you should also drink plenty of fluids. Staying well hydrated after your hemorrhoidectomy will also help soften the stool and prevent straining during bowel movements.
Okay, nurse.
Also, don't forget to include fruits in your diet. It will provide sufficient fiber and fluids, and it will be easy to digest as well. Hence ease the bowel movement. Additionally, prune or apple juice can also get your bowels moving.
I will consider that, nurse.
Is there anything else I should address for you, Mia?
No. You have cleared all my worries that I had about my condition. Thank you, nurse.
Great, I am glad to hear that. Mia, I wish you a speedy recovery.
Thank you, nurse. That is the end of your OHT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.